Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Department of Veterans Affairs has phased out alcohol and tobacco from its care model. Now, former VA Secretary Dr. David Shulkin is calling for the agency to become the first opioid-free health system in the country. He joined Federal Drive host Terry Gerton earlier to explain why the time is right and how this shift could save lives and reshape veteran care.
I'd like to ask you first, what's your assessment of the current state of the Department of Veterans Affairs, both in its institutional stability and its ability to deliver health care? They've been through a lot of changes in the past few months.
They certainly have, and I think it's a mixed picture. I think that the department remains committed to its mission, to caring for veterans, and for that I'm grateful, and I know the veteran community is grateful. I think the president and Congress has given the VA a very generous budget to be able to fulfill on that mission. I do think that there are areas that the VA is performing very strong in. They're processing benefits claims at faster rates. They're trying to make the experience for veterans easier to be able to access the care that they want. And those are all good things. But I think that the VA has, particularly early on in its first couple months, has reduced staff, has reduced some very important contracts that were probably done, in my view, a little bit hastily, so that there has been an impact. And I think the biggest impact has been on the workforce. And having led healthcare organizations all of my career, I know the single most important thing to do to be able to deliver on your commitment to veterans is to have a workforce that feels confident, secure in its future, one that feels aligned with leadership in its purpose and mission. And I think morale in the organization has suffered a great deal. So I'm hoping that we are going to see a rebuilding of that, a refocus on what's important, and re-engaging the workforce so they can continue to do the excellent job that they've been doing for decades.
Along those performance lines, the Washington Post recently published an investigative article that alleged a pretty considerable fraud in terms of veteran claims. What's your take on that and its relationship maybe to some of the other changes that have gone on in VA?
Yeah, I'm extremely disappointed in the Washington Post and the way that this article came out. I was interviewed for the article. I spent time explaining the complexity of the system and how the system often fails our veterans, who makes the veteran fight often for years to get the benefits that they've earned and they certainly deserve. And the article, which is really 2 of the 4-part series, hasn't come out yet. But at least the first 2 articles that have come out have really blamed the failures of the system on the veterans themselves. And I think that's a misjustice. I think it's a mischaracterization of the problem. And frankly, they took the easy road out by telling stories of a few bad apples rather than describing why the complexity and the bureaucracy of this system needs to be addressed and reformed if we're going to continue to honor the commitment that we owe our veterans. So it could have been a very powerful series, and let's hope that the last 2 articles do a better job. But I know it's been a great disappointment, not only to me, but to the entire veteran community.
Are there specific reforms that you would recommend to simplify the system and improve the determination of benefits?
This is one of those systems that I think you have to tear it up and rebuild it from the beginning. It's a system that was put together through a series of congressional laws that over time have been built into such a complex web that nobody can reasonably get through this process. Now, Congress tries to go in and fix it with what are called presumptives, and those are helpful, but they're building on a broken system. And every VA secretary that I've talked to has said that it was their desire and intent to rebuild and reform that system. But in order to do that, you need a real consistent plan. And I know I was building that. I had engaged a bunch of economists and others to help me do it. Unfortunately, it's one of those things that I didn't get a chance to finish. And so it's in that category of important unfinished business.
I'm speaking with Dr. David Shulkin. He's the former Secretary of the Department of Veterans Affairs. Well, I want to thank you for your frank comments on those couple of questions. You've also written a recent article on another part of the system around the use of opioids in the VA, and you drew a parallel between past VA practices like prescribing alcohol or allowing smoking to today's resilience on opioids. Tell us more about how they are used within the VA system and what you recommend.
Yeah, I use these comparisons about where we are today with opioids to where the VA had been with tobacco use and alcohol prescribing in the hospitals, because frankly, I've practiced that long in the VA hospital, so I have had the chance to see this. And in those cases, the VA lagged what the private sector was doing by decades. Now, even though the VA, I think, should have addressed becoming tobacco-free and alcohol-free many, many years before it did, I think it has the opportunity now to lead the country by becoming an opioid-free system. And in many ways, the VA can do this better than any system in the country because it offers fully integrated care. It offers unparalleled access to behavioral health care, to complementary health care services, to all sorts of options that can help veterans with pain management. I published an article describing that I believe that the VA should become the first opioid-free health system in the country. And I have to say I got feedback from a number of veterans that was not positive. They were afraid that what I was calling for was ripping away or stopping prescribing opioids to them, when in fact it's the only thing that's really keeping them alive and being able to function. I am in no way describing in an opioid-free system that we stop prescribing and rip these medications away from veterans who are dependent on them now. What I am describing is a system that no longer starts veterans on opioids, that right from the beginning, when a patient has acute pain, rather than reaching for an opioid prescription, we use the new alternatives that are available today that weren't available even a year ago. And what many people don't know is that there have been new drugs approved that do not have addictive qualities. There are many more coming down the road that are extremely powerful pain relievers without addictive qualities, that if the VA begins to start using those as the alternative, you never get future veterans addicted to these drugs. And I think it's not only possible, I think it's the moral and ethical thing to do. And I think it's another way that VA can lead the rest of the country and show how American healthcare can be run.
How ready are those alternatives for adoption within the VA system?
Could be done right now. And the VA has been regretfully slow to do it. It doesn't mean that there aren't many, many practitioners in the VA that are providing support for pain management, because I think VA is doing that very well. But there's not been a decision at the top to make these alternatives available first line. They're often available second line. And that just simply is no longer, in my view, the right way to be doing things.
Are there particular barriers to adopting this practice? You say the decision hasn't been made yet.
Yeah. The new medications coming out, not surprisingly, will be more expensive. Opioids have been around for decades and decades, and frankly, they're very, very inexpensive. The VA can buy them for pennies. And these new alternatives, just like any new drug coming out, cost more. And I think if you were to look at the pharmaceutical budget, you can understand there are people that are trying to be responsible and manage it within a cost. But what you need to think about is the total picture, not the pharmaceutical cost. The cost of having veterans addicted to opioids with what we call opioid use disorder is incredibly costly, not only in terms of dollars, more than $16,000 a year to treat opioid use disorder, but the cost in terms of veterans who have had their lives ruined, families who have been destroyed because of opioid use disorder, veterans who are now in jail because of crimes committed because of opioid use disorder. And the number one issue for the VA is the prevention of veteran suicide, with more than 17 veterans each and every day taking their life. This is strongly correlated with inappropriate pain management and opioid use disorder, as well as illicit drugs, because people can't get access to prescription opioids. So they're using fentanyl and other synthetic opioids. So I think that this is a matter of we're not looking at this in a holistic approach. And it is far cheaper, far better, and far more ethically the right decision to make sure that veterans have every alternative to opioids first.
As you seek to build consensus around this vision, are there legislative or policy changes that you'd like to see that would help move this forward?
You know, in the VA, legislation is an alternative when the VA doesn't step up and do the right thing. So the reason why I'm speaking out on this is not because I'm still running the VA, but because I hope that there will be people in the VA who agree with this and take this on and create an important change, not only for veterans, but really for all Americans, because people will follow when the VA does this. If the VA doesn't do it, then I think that's where legislative changes, and there is interest in Congress to see this happen. And I will continue to advocate for this. I am working with veteran service organizations who also believe that this should be explored and this should be pursued. And I will continue to speak out. I want to make sure that the veterans themselves understand that I approach this first as a physician, and in no way am I advocating or recommending ripping away dependent medications from a veteran. It's most important we take care of them. But I'm talking about systemic policy changes. I've called for this over a 5-year period to see this get implemented in the VA.
Dr. David Shulkin is former Secretary of the Department of Veterans Affairs. We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.